The COVID-19 pandemic has shown us once again how a new infectious virus puts those with underlying conditions at highest risk of dying. And those countries that have high numbers of people with health conditions put extra stress on the global health system. That is the word from the Director General of the World Health Organization, Dr. Tedros Ghebreyesus. He says we have entered a new phase of the pandemic where solidarity is needed now than ever before. He says they are in a race to save lives right now.
Caseloads are so high in several countries that hospitals and intensive care units are filling up to dangerous levels. For some countries, during the recent holiday period and cold weather, people mixed indoors more, which we know is riskier and will have consequences. New variants, which appear to be more transmissible, are exacerbating the situation. We call on all countries to increase testing and sequencing of the virus so that we can monitor and respond effectively to any changes. Ultimately, countries have to consider their epidemiological situation and take appropriate measures based on the data. It's a tough balancing act, but ultimately saving lives, protecting health workers and health systems must come first.
Of course, the issue of vaccination very much central to that press briefing as well, including recommendations, as I said, from the advisory body. Now, the battle against the coronavirus pandemic looks increasingly like a game of a cat and mouse between vaccine rollout and the virus's mutations, some say. After a highly infectious COVID-19 variant was found in the UK right before Christmas, another deadly strain of the coronavirus emerged in South Africa, leading some public health experts to worry that it could be an even bigger threat than the UK variant. Like the UK variant, the new strain discovered in South Africa, officially called 501YV2, involves multiple mutations inside the coronavirus at the same time. Professor Shabir Madhi is a vaccinologist at Wits University. A very good evening to you, and thank you so much for joining us, Professor. Britain's Health Secretary Matt Hancock saying, I'm incredibly worried about the South African variant. He said this on a BBC program yesterday, and of course this has been also widely published. Just first of all, your thoughts about that statement.
So I think there's some truth to the statement in that we need to be worried about the variant, but I think it's exaggerated to say that that particular variant poses a major risk to the UK or to any other country. The reality is that this variant, as of today, has already been identified in 3 other countries, including in Finland, including in Switzerland, as well as in Japan. And the places that are identifying this variant are countries that have got meaningful systems in place to do sequencing of the virus. But this variant is probably transmitted to many of our neighboring countries already. But the reason why it hasn't been identified there is that they're simply not even doing testing, let alone sequencing of the virus. So this variant is probably already quite dispersed. And I think for the UK to singularly call out South Africa and to put restrictions on South Africa in terms of travel is largely short-sighted. It's not going to assist in terms of containing this variant, which probably has already dispersed out beyond our borders.
And just let's talk about the science now. I mean, it was announced firstly with the team of experts alongside the Minister of Health what exactly it is, this variant, and how it so-called operates. So why would the British government then go as far as suspending all flights from South Africa because of a variant in South Africa when they have one themselves? And I believe that they're pretty much similar. So if we understand that viruses naturally mutate, why is there such alarm that experts in the UK are going as far as saying, you know, we're very worried that vaccines may not even be effective for this variant in South Africa? Why not worry about the one in the UK and other countries?
Right. So this particular variant in South Africa, what it's notable for is one of the first variants that has been identified, where there's mutations at three different points of what is known as a spike protein. Now, the variant that was identified in the UK has 21 different sort of mutations, but it only involves only one of the mutations involves the spike protein. Now, the reason why we're concerned is that the more variable the composition of the spike protein becomes, the greater the likelihood that vaccines that are currently developed will not be able to act against those sort of viruses. So vaccines, when you vaccinate, as you know, you produce antibodies, and it produces multiple types of antibodies against different components of the different parts of the spike protein. But the three sort of mutations that have been identified within the spike protein in South Africa are mutations that are associated with antibody that's usually important in terms of killing off of the virus or neutralizing the virus. So that's the reason why the South African variant is considered possibly to be more of a risk in terms of vaccines being able to protect against it than the British and the UK variant, where it involves only a single mutation of the spike protein that probably is of relevance in terms of vaccination.
At this early stage, is it possible to compare virulence or effectivity? The WHO's Dr. Maria Kirkova herself was saying that, you know, we still don't know much at this point. At what point will we be able to do that? To a point where then, as you say, because of our variant having 3 different protein spike points, I think that's what you said, that we would then say, actually, this is far more dangerous.
Right. So in the UK, with that variant, they've estimated that there is increase in transmissibility of that variant by about 50%. But that is based on modeling. So it's looking at different sort of data element points, including the mobility of individuals, and looking at the sort of amount of infections that's taken place. And doing that, they've been able to model that there's probably an increase in terms of transmission by about 50% by the UK variant. In South Africa, we haven't done those analysis. Whether or not the South African variant is more transmissible is difficult to tell right now. So what has been shown to some extent, although there might be some biases to it, is that individuals that were identified with these variants had a higher viral load than individuals that were previously identified to be infected with the earlier virus that was circulating in South Africa. In addition to which, we're obviously experiencing a major surge, which is temporarily associated with the emergence of this variant. But that doesn't necessarily mean that the two are linked. So I think that's important to unpack, that the temporal association is not necessarily definitive proof that there's increased transmission. The increase in transmission in South Africa is more likely a combination of factors, and probably the major driver for it for the past 2 months has been allowing people to gather in poorly ventilated indoor spacings, and the variant itself might have assisted in terms of contributing to this massive resurgence that we're experiencing. So the short answer is that we don't have definitive evidence, but there's strong empirical evidence to indicate that this variant is more transmissible. But importantly, it's not more virulent, which means that the percentage of people that will die after infected with this virus is not actually much different compared to the percentage of people that died after they were infected with the earlier viruses that were circulating in the country.
Professor Shabir Madhi, thank you so much for your time and your insights. Professor Shabir Madhi is a vaccinologist at Wits University, and you know, just giving us the science behind the variants in South Africa and the UK, and to really put into context what the scientists in the UK have been saying, raising alarm about the variant here in South Africa, including the one in the UK. And you heard Professor Madhi say the one in South Africa has also been found in other parts of the world. And of course, some are saying that because of lack of surveillance and control measures, it's difficult to say exactly just how far the variant in South Africa has spread and why. Moving on now to other news, chaos and frustration in Zimbabwe's capital city as major police roadblocks prevent movement on the first day of the returned hard lockdown. Hundreds of people were denied entry into the city centre, with police turning them back, citing the new COVID-19 regulations. Vice President and Health Minister Constantino Chiwenga announced that the hard lockdown is Saturday.